Hi, my name is Florence Bastien. I am a registered dietitian, and today we're going to explore nutritional supplements in the context of osteoarthritis. So, first, what is the role of supplements? So, supplements can provide some additional support, but they're not a substitute for the foundations of a healthy lifestyle, such as proper nutrition, weight management, regular physical activity, and ongoing follow up with healthcare professionals. So, supplements may help relieve certain symptoms, including pain, stiffness, and inflammation, but their effects are limited. So, in other words, supplements should be seen as a complementary tool, not a magic solution. So, if you are considering to try a supplement, it's important to weigh the potential benefits against the costs. So, from a scientific perspective, research mainly focuses on three major outcomes: so, the pain relief, improved joint function, and reduced inflammation. However, it's important to keep a few points in mind. So, not everyone responds in the same way, and individuals' results may vary depending on, from a person to person. And also, when benefits do occur, they're often modest and develop gradually over time. So, how to integrate a supplement? So, when you are adding a new supplement, it's best to avoid taking multiple products at the same time. So, instead, try introducing one supplement at the time and allow for a trial period. This may make it easier to assess how your body responds. So, during this period, pay close attention to any changes in your symptoms, and if you are noticing improvements in pain, stiffness, or mobility, you can now make a clearer decision whether you want to continue or not this supplement. And also, always consider the possibility of interactions with medications or existing health conditions. So, when in doubt, consult a healthcare professional before starting any new supplement. It's also important to remember that the natural health products are not risk free, so some supplements can cause some side effects or interact with medications, and that's why it's really recommended to consult a healthcare professional before taking any supplements. So that will help to ensure the product is safe for you based on your health condition and the medications you are currently taking. And if you are taking medication for any health condition, it's especially important to not stop or replace your medication with any natural health product without first consulting a qualified healthcare professionals such as your doctor, nutritionist, dietitian, or pharmacist. So, what supplements we are going to study today? So, we are going to go over 6 different supplements. So, first up, we have vitamin D. So, vitamin D is an essential fat soluble vitamin that our skin naturally produces when exposed to sunlight. It plays many important roles in the body, particularly in supporting bone health, and it may also have beneficial effects on mood. So, that's quite interesting. And vitamin D does not prevent osteoarthritis. However, having a deficiency in vitamin D may worsen the progression of the condition. So when there is inflammation around the joint, as it's the case with osteoarthritis, the nearby bones can become more fragile. So correcting a vitamin D deficiency may therefore be helpful in supporting both bones and joint health. So who may benefit vitamin D supplementation? So it's people with limited sun exposure, such as those living in North America, especially during periods of low sunlight, so between the month of October and the month of May. And the dosage recommended is 1000 IU of vitamin D3 per day taken with a meal. So next up we have omega-3 fatty acids. So those are considered good fats and they're essential to our health, and it's important to consume them regularly because our bodies cannot produce them on their own. The main dietary sources include fatty fish such as almond, sardines, as well as fish oils. And omega 3 are also found in nuts and seeds, but in forms that are much less available to the body and less well absorbed by the body. So, for the people who eat little to no fatty fish, supplements can be helpful when dietary intake is insufficient. And there are three main types of omega-3 fatty acids. So we will focus on EPA and DHA in particular because they can offer many health benefits. So by example, they can possibly reduce the risk of heart disease. They may lower blood pressure, help prevent blood clot formation, and they can also reduce triglyceride levels in the blood. And interestingly, they can also decrease inflammation. So, by reducing inflammation, they may also help reduce pain and stiffness in the case of osteoarthritis. So, who may benefit this supplementation? Well, it can be simply healthy adults or adults at risk of cardiovascular disease or established heart disease, and also some adults with inflammatory conditions. So the recommended intake ranges between 250 and 1000 milligrams of EPA and DHA per day. You can ask your nutritionist, dietitian, or doctor if you'd like to have a personalized recommended dosage. Some studies have used some much higher doses, like over 2 to 3,000 milligrams per day. So they were associated with great reductions in inflammation for some people, but it's important to be cautious here for some people because high doses may increase the bleeding risk in individuals taking anticoagulants. So the best is to consult a healthcare professional before starting this supplement. The third supplement we're looking at is the hydrolyzed collagen. So, collagen is a protein that helps form the structural framework of the joints. So, it's naturally present in cartilage, tendon, ligaments, and it plays an important role in the joint strength and integrity. So some studies suggest that collagen supplementation may help reduce joint pain, improve joint function, relieve discomfort, and may even contribute to increased cartilage thickness. So overall, collagen supplements are generally very well tolerated with little to no reported side effects or health risks. So if you're thinking about trying it, and if you're curious about hydrolyzed collagen, it's usually in the form of powder. So the dose we recommend is between 5 to 15 grams of collagen. We recommend to take it with a source of vitamin C because vitamin C helps your body to absorb collagen more effectively. And that could be, by example, an orange or a small glass of orange juice or even a vitamin C supplement. And if you're looking for a lower cost option, gelatin can also work. So, taking between 5 to 15 grams per day along with vitamin C can provide similar effect to the hydrolyzed collagen powder. So the fourth supplement we're looking at is the curcumin. So here we're not talking about the spice that we use as a cooking spice, but about curcumin. So it's the concentrated active compound found in turmeric. It's used as a supplement to help with osteoarthritis. So the curcumin supplement provide a much more concentrated extract and have some anti-inflammatory properties. And some studies show that curcumin can be comparable to NSAIDs in reducing osteoarthritis pain and stiffness, but with fewer side effects. So it can be interesting for some people. The recommended doses is about 500 milligram twice a day taken with meals. And this supplement is also a supplement that you should be asking your healthcare professional before taking it, since it can have some interactions with other medications. And now the glucosamine and chondroitin. So those are natural components of cartilage. They may also slow down the breakdown of joint cartilage. And some studies suggest that they can relieve osteoarthritis related pain. So those supplements may also have mild anti-inflammatory effects in addition to potential cartilage protection benefits. However, research is limited and results are mixed. Any benefits are usually modest and may be most noticeable in people with moderate to severe pain. Be careful here again, because this supplement can interact with blood thinners like warfarin. They also may affect blood sugar levels. So one study also suggested that they could increase eye pressure. So if you have diabetes or glaucoma, it's best to avoid these supplements, or at least check with your doctor first. And if you'd like to try this supplement, the recommended dosage is between 300 to 500 milligram per day, up to 3 times daily. So MSM is a natural compound found in fruits and in green vegetables. Some studies suggest it might be helpful to improve osteoarthritis symptoms and provide the body with some antioxidant protection. Just be careful, because MSM can cause some side effects, including some allergic reaction for some people. So it's important to just keep that in mind. And the recommended dosage for this supplementation is typically up to 3,000 milligrams per day. So it's important to keep in mind that supplements have limitations, and their effectiveness can vary from person to person, and they also can be costly, or sometimes they can have unpleasant taste. And also, many supplements lack strong evidence to prove a clear benefit, and some supplements may carry risk of side effects. And for certain supplements, it can take time before you notice any benefits, as the body may need to build up the nutrient first. So, in short, supplements can help, but they are not a quick fix or a magic solution. And to finish the presentation, a quick reminder that supplements can support your health, but they do not replace the basics. So yes, they may relieve certain symptoms, help some people, but they do not replace regular movement and exercise, balanced diet, ongoing follow-up with healthcare professionals. And it's important to weigh the pros and cons and discuss any supplements with a healthcare professional, so you make an informed decision. So thank you.